Hey, welcome back to my channel where we talk about marathon running and we talk about physical therapy. So I want to talk to you today if you're having any foot or ankle pain. You want to take a look at what your foot structure looks like. So if you have a supinated foot or a high arch, foot kind of comes in like this. Make sure that you are able to pronate your foot. So if you're supinating, work on exercises that control that pronation coming in. Because if your foot is supinated and it's rigid, you're gonna want to work on pronation. Maybe a little bit of backwards walking carefully on the treadmill can help with that. Things that are going to help your foot to relax, right? Because it's rigid. So during running, when we land softly and we got to pronate a little bit, meaning our foot is going to flatten a little bit. So if you can't flatten your foot, you're not going through that phase of pronation, which is important. A lot of people think of pronation as a bad thing, but you need a certain degree of flattening of your foot and then tightening. Call that the rigid lever, and then you push off. All right, so work on just balance activities where you can just kind of control that pronation coming in and coming out. A good way to work on that, if you want to work on, so a big muscle, your posterior tib, it works eccentrically when you're pronating. So work on eccentric, just meaning lengthening of the muscle. So work on exercises that are going to work the posterior tib eccentrically. So like do like a slow count while the muscle's contracting, but it's lengthening. Okay, that's eccentric strengthening of the posterior tib. And then again, like I said, functionally, so like backwards walking and focusing on just pronating as you're reaching your toe backward and focusing on that flattening of the foot can help your pronation. So that's if you have a supinated high arch type of foot. Now, if you have the opposite, if you have pronated or flat feet, you're going to do the opposite, right? Because you're likely having a hard time supinating and making your foot more rigid. So you would want to work on the concentric phase of the posterior tib. All right, a lot of calf raises with the knee bent, calf raises with the leg straight, calf raises with a ball between your heels, right? Because you want to get your calcaneus or your heel bone to kind of, as you come up on your toes, to kind of come in. And that's all posterior tib. So if you're squeezing a ball between your heels and you're pressing up, that's going to get that posterior tib. That's going to help you supinate. All right, you can do some inversion of your foot. And while you're running, you want to focus on this as well. So you're likely landing with a nice flat foot, but you're not able to create that rigid lever. So you want to focus on tightening and supinating your feet as you go to push off, right? As you go to push off. So it'll make you a little bit more springy. So you can focus on that while you're running, especially. And you want to focus on that during your strength training exercises, your balance, your stability, creating that rigid lever, that supinated foot, and becoming more explosive, right? Tightening your foot and pushing off the ground. So you can do that through like pogos. See where your level's at. Pogos can be a little bit of a higher level activity. But just single leg balance, tightening of your foot, pressing up into a calf raise real tight, slowly lower down. Focus on control because your foot has to go through these phases, right? So it lands rigid, it pronates, and then it gets rigid again, and then you take off. So that's a lot to go on while you're running in terms of phases of the foot. But it can help take care of your foot pain. So first you want to figure out, and this is all general, right? Like if you have this general idea, it should take care of most cases if diagnosed and rehabbed properly. But see a professional and get diagnosed. But keep this kind of structure in mind, right? So keep your structure in mind. Do you have more of a rigid supinated foot, or do you have flat feet? And just make sure your foot's going through those phases each time it hits the ground, and work on the phase that you may not be going through, right? So if you know you're not pronating enough, work on pronation, and it should help you out. But if you have any further questions, feel free to reach out. I look forward to seeing you guys on the next one.